Hello, I'm Justin Gallagher from the Managed Markets News Network. This week, CVS stunned the healthcare community with the announcement that it will wait for the FDA to approve a second PCSK9 inhibitor before it negotiates prices on this new class of cholesterol drugs. CVS's Chief Medical Officer, Dr. Troyan Brennan, said all bets are off when deciding who will get these drugs after Sanofi and Regeneron set a price of $14,600 a year for alirocumab, the first drug in the class, which the FDA approved on July 24th. Amgen's version, evolocumab, comes up for approval August 27th. CVS, the number 2 pharmacy benefit manager in the country, snubbed Sanofi and Regeneron after they paid $67 million for an orphan drug voucher, which let them jump ahead of Amgen in the approval process. In a separate action, CVS's Chief Scientific Officer, Dr. William Schrank, a frequent contributor to the American Journal of Managed Care, called on the American College of Cardiology and the American Heart Association to set guidelines for when PCSK9 inhibitors should be prescribed. Dr. Schrank said, if used broadly, PCSK9 inhibitors would likely be the most costly class of medications we have seen thus far. The use of steroid therapy could save lives for adults who are hospitalized with pneumonia, according to a study published this week in the Annals of Internal Medicine. Researchers examined data from 13 trials involving more than 2,000 patients. They determined that all-cause mortality fell from about 9% to 5% with this therapy, which also reduced the need for ventilation and made patients less likely to experience acute respiratory distress. Patients treated with steroids also spent 1 fewer day in the hospital on average, reducing healthcare costs. According to lead author Dr. Reid Semniak, corticosteroids are inexpensive and readily available. Millions of patients will benefit from this new evidence. In recent weeks, there has been renewed attention to the need for enforcement of the federal parity law for mental health. The Affordable Care Act has brought coverage to millions, many of whom are seeking mental health care for the first time. For many, the primary care practice can be the first stop for those in need of mental health treatment, but the stigma of asking for help can prevent patients from seeking care. Dr. Joseph Santapietro of the Carolinas Health System spoke with AJMC.com about how stigma acts as a barrier for patients.
Stigma keeps people from wanting to talk with their doctors about what's going on. Stigma keeps us from investing in mental health research the way that we need to. And it affects communities and institutions, which is why I'm so proud of Carolinas healthcare system, which is a big healthcare system in North and South Carolina, 42 hospitals and 13 million patient encounters last year. And this big system that actually had been doing mental health for years, but in silos basically, decided that it really needed to address this issue head on. And some big part of that is culture change. It's really, I mean, to be frank, it's working against stigma. You know, at the highest level of the organization, people really get in their bones that this is important. We can't ignore it. We have to actually lean into it as opposed to leaning away from it. So stigma is a huge barrier.
2 leaders from the FDA outlined how the agency has played a key role in the rise of precision medicine in this month's issue of Evidence-Based Oncology. Dr. Sean Kozin and Dr. Gideon Blumenthal, both from the Office of Hematology and Oncology Products, give us an overview of the investments being made in precision medicine, a history of the agency's contributions to the field, and a list of important approvals made thus far. With the FDA's role in precision medicine increasing, this article is a must-read. You can find it at ajmc.com. If you want to know more about how the FDA regulation will affect precision medicine in the future, plan to attend our upcoming conference, Patient-Centered Oncology Care, which will be held November 19th and 20th at the Marriott Waterfront in Baltimore. There is still time to register. For our agenda and registration, visit our meetings page at ajmc.com. For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.